Over the last 30 years, I've seen it again and again. People over 50 struggling with a pain that starts low in the back. It's not just a twinge, it's a hidden problem that quietly steals energy, flexibility, and even joy. Some can't straighten up after sitting. Others struggle to put on socks, bend, or roll in bed without discomfort. And most of them have no idea why. Spot the pain early. As we age, our bodies go through natural changes. And one of the most common issues people over 50 face is low back pain. A significant contributor to this discomfort is the lumbosacral joint, the lowest joint in the spine, which often becomes stiff, irritated, or restricted over time. Recognizing the early signs of trouble in this joint is crucial, because the sooner you identify the problem, the easier it is to address it before it becomes chronic or severely limiting. Many people dismiss low back pain as a normal part of aging, but understanding what is happening in your spine can empower you to take action and prevent further complications. One of the first ways to know that your lumbosacral joint may be causing pain is to pay attention to how your body feels after sitting. If you find it difficult to straighten up after getting up from a chair, or if you experience a sudden stiffness in your lower back, these are strong signals that the joint may be restricted. Similarly, pain that appears when bending forward, lifting objects, or even performing daily tasks like putting on socks or shoes is another indication that the lumbosacral joint is not moving freely. For some people, stiffness is most noticeable in the morning as the joint tightens overnight, making it challenging to get out of bed. Others may notice discomfort or difficulty when rolling over during sleep. These early signs may seem minor at first, but they are often the body's way of warning you that the joint is under stress and needs attention. Understanding the underlying cause of these symptoms is also important. One of the main contributors to lumbosacral joint issues is prolonged poor posture, particularly when sitting. Slouching or allowing your lower back to sag while seated puts extra pressure on the joint, causing it to jam out of its normal position. This is especially common when sitting on soft surfaces like couches or beds, or when lifting your feet up while sitting. Over time, this repeated stress can lead to inflammation, stiffness, and pain. Recognizing these habits in your daily life and correcting them early can prevent the joint from becoming further irritated. Early identification also means you can take steps to maintain mobility and strength in your lower back before the pain becomes severe. Gentle stretches, simple rotations, and strengthening exercises can all help keep the lumbosacral joint flexible and supported. Even small changes, like sitting with proper support, taking breaks to stand and move, and listening to your body's signals, can make a big difference in preventing the progression of pain. By paying attention to how your back feels during routine activities and addressing stiffness as it appears, you set the foundation for long-term spinal health. Ultimately, recognizing low back pain as a potential lumbosacral joint issue empowers you to take proactive steps. It's not about avoiding aging or fearing discomfort. It's about understanding your body and acting early. The more aware you are of the subtle signs, difficulty straightening after sitting, stiffness in the morning, or discomfort during bending, the better you can respond with targeted exercises, posture adjustments, and healthy habits that keep your back strong, flexible, and pain-free. Paying attention to these signals is the first step toward maintaining an active, vibrant, and energetic life well into your later years. The sit right, stay safe sitting may seem like one of the most natural and harmless activities in daily life, but the way we sit can have a profound impact on our lower back, especially as we age. Many people over 50 develop low back pain simply because of poor sitting habits, and the lumbosacral joint, the lowest joint in the spine, is particularly vulnerable. This joint supports the weight of the upper body and plays a critical role in movement and posture. When it becomes jammed, stiff, or irritated due to improper sitting, it can cause significant discomfort, limit mobility, and even interfere with daily activities. Understanding how to sit correctly and why posture matters is a crucial step toward maintaining spinal health and overall well-being. One of the most common mistakes people make is slumping or letting the lower back sag while sitting, especially on soft surfaces like couches, recliners, or even in bed. When the pelvis tilts backward and the spine curves unnaturally, the lumbosacral joint is compressed in the wrong position. Over time, this repeated strain can lead to inflammation, stiffness, and pain, often manifesting as difficulty straightening up after sitting or discomfort when bending and lifting. Even seemingly minor habits, like sitting with feet elevated on a couch or leaning back in a soft chair, can place excessive stress on this joint. It's easy to think that a cushioned seat is more comfortable, but in reality, it can worsen joint problems over time. Correct sitting posture is essential to prevent and alleviate these issues. The key is to sit fully back in your chair so that your lower back is supported and the natural curve of the spine is maintained. Using a small cushion or lumbar roll behind the lower back can help support the natural arch and prevent the pelvis from tilting backward. Feet should rest flat on the floor and knees should be at roughly a right angle to promote proper alignment. Even small adjustments, like bringing your hips slightly forward or keeping your weight evenly distributed, can reduce the strain on the lumbosacral joint and prevent the joint from becoming jammed. Sitting correctly is not just about avoiding pain. It also allows you to move more freely and maintain strength in the core and back muscles. Proper posture helps distribute weight evenly across the spine and supports the muscles that stabilize the pelvis and lower back. Over time, sitting with awareness and using supportive strategies can significantly reduce the risk of chronic back pain. By making conscious choices about how you sit, supporting your spine and breaking up long periods of sitting, you empower yourself to protect your lumbosacral joint and maintain mobility, energy, and independence as you age. Sitting may be a daily activity, but how you do it can make the difference between comfort and persistent low back pain. Barn the stretch to loosen, keeping the lumbosacral joint flexible and mobile is essential for preventing low back pain and maintaining overall spinal health, and targeted exercises play a central role in achieving this. As we age, the joints in our lower back naturally lose some of their flexibility, and stiffness can develop, especially in the lumbosacral joint. This stiffness not only causes discomfort but also limits movement and increases the risk of injury during everyday activities like bending, lifting, or even twisting to reach for something. Stretching and gentle mobilization exercises are powerful tools to restore proper alignment, relieve tension, and promote healthy movement in the spine. One of the most effective ways to mobilize the lumbosacral joint is through movements that gently open and realign the joint in its natural position. Many people develop a backward tilt in the lower back from prolonged sitting or poor posture, which can jam the joint and create pain. Exercises that encourage the lower back to extend slightly in the opposite direction can provide immediate relief. Simple movements, such as lying face down on a firm surface and gently lifting onto the elbows, allow the joint to move in the direction it naturally prefers. This small adjustment can often reduce stiffness and even alleviate pain in as little as 30 seconds. The key is to listen to your body and adjust the intensity. If lifting onto the elbows feels uncomfortable or painful, it's better to skip this exercise and move on to a gentler option. Rotation exercises are another highly effective way to stretch and loosen the lumbosacral joint. Lying on your back with your knees bent and slowly moving them side to side allows the lower spine to rotate gently, which mimics the techniques used by chiropractors, osteopaths, and physiotherapists to release tension in this area. This rotational movement not only stretches the joint itself, but also engages the core muscles, helping to support the lower back and improve stability. Even small, controlled movements can make a significant difference over time, especially when performed consistently. Gravity can also be a helpful ally in mobilizing the lower back. Letting one leg hang off the edge of a bed or surface allows gravity to gently pull the pelvis and lower spine, creating a subtle stretch that relieves tension in the lumbosacral joint. By combining this with controlled breathing and mindful relaxation, the muscles surrounding the joint can release more effectively, enhancing mobility and reducing discomfort. Consistency is key when it comes to stretching and mobility exercises. Performing these movements daily, even for short periods, helps counteract the effects of prolonged sitting, supports spinal alignment, and maintains the flexibility needed for everyday tasks. Over time, the lumbosacral joint becomes less prone to stiffness, and the surrounding muscles strengthen and adapt to support healthy movement patterns. This proactive approach not only relieves current discomfort, but also reduces the likelihood of future back problems, helping you maintain an active, energetic, and pain-free lifestyle well into later years. Stretching and gentle mobilization are simple, practical tools that can make a profound difference in your spinal health and overall quality of life. And the strengthened core and pelvis, strengthening the core and pelvic muscles, is a fundamental part of maintaining a healthy lower back and supporting the lumbosacral joint. As we age, these muscles naturally weaken, which can lead to instability in the spine and pelvis, increasing the risk of pain and injury. The multifidus muscle, one of the deepest muscles in the lower back, plays a critical role in stabilizing the spine, while the muscles that keep the pelvis level ensure that weight is distributed evenly and that the lower back is not subjected to unnecessary stress. When these muscles are weak, the lumbosacral joint can tilt or shift out of alignment, causing irritation, inflammation, and discomfort. Targeted strengthening exercises can help restore balance, improve stability, and reduce the likelihood of recurrent low back pain. One of the most effective ways to engage the multifidus and core muscles is through controlled movements performed on hands and knees. By keeping the back flat and tightening the stomach muscles slightly, you create a stable base while performing exercises that lift one arm and the opposite leg. This movement requires the spine to remain stable, forcing the deep muscles of the lower back to activate. Holding the position for several seconds without shifting weight to one side ensures that the muscles are properly engaged, building endurance and strength over time. Repeating this exercise on both sides several times a week gradually improves spinal support and makes everyday activities such as bending, lifting, and twisting much easier and less painful. Pelvic stability is equally important for supporting the lumbosacral joint. The muscles around the pelvis work in concert with the core to maintain proper alignment and prevent the joint from tilting or becoming stressed. Simple exercises like standing on one leg and moving the other leg in slow, controlled circles can activate these stabilizing muscles. Balancing in this way challenges the muscles to hold the pelvis level, improving coordination and strength. Adjusting the height and angle of the moving leg adds variety and progressively challenges the muscles, ensuring continued improvement. Even short daily sessions of these exercises can make a significant difference over time, strengthening the muscles that keep the pelvis and spine aligned. Strengthening exercises do more than just reduce pain. They improve overall function and quality of life. A strong core and stable pelvis provide a foundation for nearly every movement we perform, from walking and climbing stairs to reaching for objects and maintaining balance. This is especially important as we age because it helps prevent falls, reduces the risk of injury, and allows us to stay active and independent. By consistently targeting both the deep spinal muscles and the muscles that stabilize the pelvis, we create a system of support that keeps the lumbosacral joint healthy and resilient. Integrating these exercises into a regular routine, even for just a few minutes several times a week, builds strength gradually and safely. Combined with stretching, proper posture, and mindful movement, strengthening the core and pelvic muscles is a key step in maintaining a healthy, pain-free back.